Now that hospitals have resumed elective procedures, CAMC wants patients to know the steps taken to ensure safety for all. Your medical provider will discuss with you what factors will influence the timing of your procedure and whether it should be done now. Your procedure will be scheduled based on your provider's decision. During this initial contact with your provider, a COVID-19 screening tool will be completed. You will be scheduled for pre-admission testing either on-site or over the phone. As part of your pre-admission testing, we will conduct another COVID-19 screening. If you are deemed to be symptomatic or at risk after screening, you will be directed to additional medical services, such as your primary care physician, 24/7 care virtual visit, or the emergency room if you're experiencing a medical emergency. Your procedure may be postponed if you test positive for COVID-19. Your provider will discuss your case with other members of the procedural team to make a decision. Based on CDC recommendations, to minimize risk for exposures, you must wear mouth and nose coverings before entering any of our facilities. Cloth masks are acceptable. Do not come to the hospital if you are feeling sick or experiencing any symptoms of fever, cough, shortness of breath, sore throat, runny nose, muscle aches or pains, or diarrhea. Please maintain social distancing and keep at least 6 feet distance between you and others in public areas. Do not bring large garment bags or valuables with you. Visitor restrictions remain in place. Patient caregivers are permitted only if required for direct patient assistance and may only enter the facility for drop-off and pickup. Caregivers must wear mouth and nose coverings and will not be allowed to stay in the waiting areas. Our staff will be in contact with your family to provide regular updates and notify them when you are ready for pickup. At the time of your arrival to the hospital, an initial screening will be completed at the entrance for all patients and necessary caregivers. After you register and sign in, you will proceed to a holding area where you will be screened again right before your procedure. Remember, hand washing and using hand sanitizer are the most effective ways to reduce the spread of viruses. If all goes well with your screening, you will proceed to the pre-op area and move to the operating room or procedural area. During your procedure, your caregiver will be asked to wait outside of the hospital for the duration of your procedure. We will ensure that they receive periodic updates about your condition. Once your procedure is completed, you will be moved to a recovery room for monitoring. Your provider will determine your discharge disposition and readiness to go home. When you are ready for discharge, we will notify your caregiver that you are ready for pickup. We will provide you with clear discharge instructions on how to safely manage your care at home, including who to contact and where to turn if there are any type of surgical complications. Your discharge instructions will include information about your medications, and we will address any questions that you may have to manage your medications at home. It is very important that you schedule all of your follow-up visits as soon as possible. Thank you for choosing CAMC.